We're back revealing the biggest dangers of over-the-counter painkillers in your medicine cabinet right now. Ibuprofen may treat your back or your joint pain quickly, but if you use it long-term, you can triple your risk for stroke. You can also increase your chances of having a heart attack. Ibuprofen is an over-the-counter medication. It's found in lots of things like Advil and Motrin and Midol. And I was astounded to read this because we know too much ibuprofen can cause stomach bleeding and kidney damage, but I never thought about stroke. So Dr. Devi, how can it triple the risk of stroke?
Taking ibuprofen for long periods of time can cause you to retain water. That actually can cause blood pressure to increase, and high blood pressure affects the small blood vessels that go to the brain and to the heart. It also can make you more likely to form blood clots, and those can also damage those blood vessels.
So it's a 1-2 punch.
Exactly. And the important thing to remember is that ibuprofen is a drug. It's not a vitamin. So it's not safe to take this drug continuously, even though treating pain is important.
Let me address that. 1,200 milligrams is the maximum dose. That's about 6 of the normal size pills you might take. The labels for ibuprofen will warn you not to take it for more than 10 days in a row. That's why we bring this comment up about vitamins, because a lot of folks do just sort of pop them in their mouth like they're not a big deal. I personally think 3 days a week is the max you ought to be taking these medications. If you need to take it for longer than that, you ought to talk to someone or find some alternative way of dealing with your discomfort. So Rebecca uses ibuprofen for her chronic muscle and back pain. How are you?
Good, and yourself?
And how often do you use it?
I use it almost daily for my lower back pain and oftentimes my hip pain. I travel a lot, so when I get stuck in the airplane for hours, it's just bad. So when it's really bad, I'll take an extra dose, even though maybe I shouldn't be doing that.
All right, let me show you why that's a concern to me. You're going to enjoy this little demonstration. So this is your body, and your body will sometimes have aches and pains represented by this cup here. When you take a pain reliever, let's just say ibuprofen, there's a limit to how much will be impactful on that pain. So if you take the right amount, you'll quench the pain, and you'll be in good shape. But if you take more, just because it didn't work the first time, that doesn't mean it's better for you. If you increase the amount you can take beyond the dose that your body can tolerate, all of a sudden, what happens? You begin to impact the body in a very dramatic way. And as it overflows, you don't quench the pain anymore. That excess ibuprofen becomes dangerous. It causes side effects for the body, as we just learned. And this process, unfortunately, because we don't realize it, gets worse and worse and worse for a lot of folks. And every little bit extra you take once you've gotten past that limit is harmful to you. So what are the warning signs that you're taking too much of ibuprofen?
Well, high blood pressure is one of the warning signs. So normal blood pressure is 120/80. If you see an increase in that blood pressure, it might be related to regular medication use. You know, we're used to thinking about high blood pressure as being related to diet, but it can also be related to ibuprofen.
And I would love to share some thoughts with folks about alternatives to these painkillers, which is a big message for me today. And again, you can find ways of treating your pain that have nothing to do with taking a pain medication. Share this alternative with us.
Well, you can alternate or switch between taking oral pain medications or pain pills and taking these pain patches. Pain patches tend to be safer because you're putting them directly on the skin. So the medication goes through the skin to the area that's affected. It can bypass the gut where people can get stomach upset, nausea, and other ulcers and things. And you want to look for patches that actually have methyl salicylic acid, which is anti-inflammatory, or menthol, which can numb the pain.
Yeah, I'm taking these back to Rebecca over there. In the meantime, everybody, we'll be right back.
Up next, it's a wonder drug.
They can not only ease your